Dr. George Springer. I'm with LifeWorks Wellness Center, and I'm here to talk to you today about thyroid or thyroid conditions. Probably thyroid is the most misdiagnosed condition I think I see in my office. And I think there are three primary reasons for this. Oftentimes, people have gone to see doctors, they've had the symptoms they think is related to thyroid, and they go see their doctor, and the doctor runs the test, and the doctor comes back and says there's nothing wrong. And the reason for that is a lot of times there's inadequate testing. The doctor will do a TSH and T4, which is the baseline to look at thyroid, and from that he'll make a diagnosis that looks fine, that everything else must be okay. And unfortunately, there's a lot of other tests that need to be done adequately to evaluate what's going on as far as the thyroid is concerned. So I think that's one of the reasons that we have that. The other reason is that a lot of times all hormones, it's not just true of thyroid, but thyroid is not metabolizing correctly. So as a result, the thyroid levels may be one thing in the blood, but they're not working the way they should at the cells. And we have some specialized ways of being able to determine if the body is indeed paying attention and using those hormones the way they should be. So that's another very important missing link many times to the thyroid conditions I end up seeing. And of all the glands I've worked with, having taught endocrinology for the years I did, the thyroid gland is more susceptible to other changes in other hormones more than any other gland. So for example, if your adrenals aren't working the way they're supposed to, your thyroid is also not going to be working the way it needs to. And so you may not really have a thyroid issue as much as you perhaps do have an adrenal issue. Or maybe you have excess estrogen. There's ways to make those determinations. So you really need to look at the thyroid as a whole part of the overall immune system, the hormonal system, and that makes a big difference in terms of what we will get accomplished a lot as well. There's also the area that we have in terms of treating the person and not the lab test. When people come in and tell me that they're gaining weight and they're losing their hair and they're having issues in terms of being cold, the outer third of their eyebrows are gone, those are all signs of low thyroid. And regardless of what the lab tests say, we want to make sure that we pay attention to the patient's symptoms, because ultimately that's the thing that really reigns and the thing that we really pay attention to. And I think that's the last important part about thyroid. So if you have the right kind of testing, you make sure your thyroid's working the right way and make sure it's balanced with the rest of the thyroid hormones. And those are the things that we try and get accomplished here as far as LifeWorks is concerned. That's our approach to thyroid, why we have such good successes with the everyday low-functioning thyroid from Hashimoto's disease, which is a more serious autoimmune condition of the thyroid. We've really kind of unraveled the mystery, if you will, of the thyroid. So if you'd like to learn more about that, I'd like to have you call LifeWorks Wellness Center. Telephone number is area code 727-466-6789. Again, that's area code 727-466-6789. We'd love to help you.